Dr. Mary Claire Haver, a medical doctor, is on a mission to educate women about the impact of menopause on their health and well-being. She believes that medicine is not up to speed on the true clinical impact of menopause and how it accelerates the path to certain disease states. Through her work, she aims to empower women to take control of their health and improve their health span, not just their lifespan. Dr. Haver highlights the fact that women are living longer but are not necessarily living healthier, especially in the last one-third of their lives. Menopause, a natural stage in a woman's life, brings about hormonal changes that can have far-reaching effects on various organ systems in the body. These changes can lead to symptoms such as hot flashes, weight gain, joint pain, cognitive decline, and more. Estrogen, progesterone, and testosterone are essential hormones that play a crucial role in maintaining a woman's health. During perimenopause and menopause, the levels of these hormones fluctuate, leading to a hormonal imbalance. This imbalance can result in a range of symptoms and health issues, including increased visceral fat deposition, inflammation, insulin resistance, and an elevated risk of cardiovascular disease, stroke, and diabetes. Dr. Haver points out the lack of emphasis on menopause in medical education and research. She highlights the disparity in the number of studies and articles focused on pregnancy compared to menopause, indicating a significant gap in understanding and addressing the health needs of menopausal women. The societal stigma and lack of awareness surrounding menopause further contribute to women feeling dismissed and unsupported in managing their symptoms. The Women's Health Initiative study, which linked hormone replacement therapy to an increased risk of breast cancer, has had a lasting impact on women's perceptions of hormone therapy. However, Dr. Haver explains that the study had limitations and that hormone therapy, when used appropriately and at the right time, can offer significant benefits in reducing the risk of cardiovascular disease, dementia, and other health issues associated with menopause. Dr. Haver emphasizes the importance of personalized care for menopausal women, taking into account their individual health needs and risk factors. She advocates for a holistic approach that combines hormone therapy, lifestyle interventions, and regular monitoring to optimize women's health during and after menopause. By educating women about their bodies and the changes they experience during menopause, Dr. Haver aims to empower them to make informed decisions about their health and well-being. Dr. Haver emphasizes the significance of visceral fat in menopause and its impact on women's health. She discovered that women with higher fiber intake tend to have less visceral fat, leading to reduced inflammation and improved blood sugar levels. Fiber also plays a crucial role in promoting gut health, reducing inflammation, and aiding in weight management. She recommends an intake of at least 25 grams per day and also emphasizes the need to focus on whole foods and limit added sugars to support overall health during menopause. Incorporating resistance training into the exercise routine is essential for women during menopause. Dr. Haver stresses the importance of building muscle mass to combat frailty and insulin resistance as women age. She encourages women to prioritize strength over cardio and engage in progressive load weight training to maintain muscle mass and overall health. Dr. Haver discusses the significance of adequate protein intake for women, especially during menopause. She recommends consuming 1.5 to 1.7 grams of protein per kilogram of lean body mass to support muscle health and reduce frailty. Protein plays a crucial role in muscle synthesis and overall health, making it essential for women during the menopausal transition. Addressing sleep quality and stress management is vital for women's health during menopause. Dr. Haver highlights the impact of stress on women's bodies and the need to prioritize self-care and mindfulness practices. She emphasizes the importance of creating a healthy sleep environment, managing stress levels, and seeking support when needed to promote overall well-being. Dr. Haver discusses how women experience stress differently than men and the importance of recognizing and addressing stress in women's healthcare. She emphasizes the need to believe women's complaints and provide appropriate care and support to address their unique stressors and health concerns. She shares a personal anecdote about encountering the term whiny woman during her medical training. She reflects on the biases and stereotypes surrounding women's health complaints and the importance of challenging these misconceptions to provide better care for women during menopause. Dr. Haver discusses the impact of estrogen loss on women's gut microbiome during menopause. She highlights research showing that the gut microbiome shifts towards a less healthy composition as women go through the menopausal transition. This change underscores the importance of supporting gut health and overall well-being in women during this phase of life. Hormone replacement therapy, HRT, is a treatment option that can help alleviate menopausal symptoms by replacing the hormones that the body no longer produces in sufficient quantities. Dr. Haver highlights the benefits of HRT in improving quality of life, reducing the risk of certain health conditions, and supporting overall well-being. However, she also stresses the importance of individualized care and informed decision-making when considering HRT, as it may not be suitable for everyone. When considering hormone replacement therapy, Dr. Haver advises women to seek out healthcare providers who are knowledgeable about menopause and HRT. By finding a doctor who is open to discussing HRT and exploring treatment options, women can make informed decisions about their health and well-being. It is essential to ask questions about the potential risks and benefits of HRT, as well as to understand how different hormone formulations may impact individual health outcomes. In addition to hormone replacement therapy, Dr. Haver discusses the role of supplementation in supporting women's health during menopause. She recommends focusing on key nutrients such as fiber, vitamin D, magnesium, and omega-3 fatty acids to address common deficiencies and promote overall wellness. By incorporating these supplements into their daily routine, women can optimize their nutritional intake and support their bodies through the changes associated with menopause. Dr. Haver emphasizes the importance of community in supporting women through the menopausal transition. By sharing stories, experiences, and resources, women can connect with others who are going through similar challenges and find a sense of solidarity and empowerment. Building a supportive community can help women feel less isolated and more informed about their health, leading to better outcomes and improved quality of life. As a champion for women's health, Dr. Haver is dedicated to empowering women to take control of their health and well-being during menopause and beyond. By providing education, resources, and support, she helps women navigate the complexities of menopause with confidence and resilience. Through her work, Dr. Haver is leading a movement to change the conversation around menopause and ensure that women have the knowledge and tools they need to thrive in this transformative phase of life.